This is the NeuroFlex Restorative Hyperextension Stop. This is for patients who have upper extremity extensor tone. Now, it can be used for whatever problem. Again, we just want to provide you with the tools that you can be creative and using your imagination, provide for the needs of your patients. But it's designed for those type of patients, and that's usually some type of brain, a stroke, anoxia, some type of brain damage. It could be from cancer. But for whatever reason, from basically the waist up, the patients are firing back. They're pushing back, and that's devastating. And way too often we find these patients reclined in a chair. All that does is feed the tone. What we need is good 90-degree pelvic tilt. You want 90 degrees at the hip. Here's your back, here are your thighs, and we want them at 90 degrees, maybe even a little forward. That will break that tone and you'll see them relax. These are people that have trouble getting words out, getting complete sentences out. They can be confused. It's just amazing what it does to them, because you've got all these nerve conduction, these sparks flying at their brain, and their brain starts to slow down and say, I can't handle all this. But if you'll maintain them at good 90 degrees, and you'll be amazed. So for that, we use the Vertebrese TLSO, and we've already put it on them. Then we add the Hyperextension Stop, and it simply slides down in the back of the device. And this goes wherever on the back of the head you find it that it does the most efficient job. Now, we used to actually, if we needed it farther forward, to take the head farther forward, we would add another roll of material. But we try to keep everything as low profile as possible. It's not like orthopedic where it's sleek and sporty looking. We want our products padded enough that they are comfortable and cause no harm. But what we've discovered, that we can just heat mold this vertical slat and move it a little forward, then these patients are typically not walking around. It would be probably dangerous if their tone kicked in and they went backward. They would fall. Now, you may have patients that do, and that's wonderful if they're safe. But by pushing this a little forward, and the patient is sitting in the chair, and this is from birth on up. It's not just the elderly people. You have kids with cerebral palsy, traumatic brain injury, shaken baby syndrome, to adolescents, young people, adults. You have car accidents, drug overdose, anoxia, drowning. It's amazing. Cancer, the different problems that people have at all ages. And we manufacture these for all those age patients. If we can stop it at childhood, imagine the deformities that we can prevent and the quality of life that we can help our patients have for maybe 60, 70, 80 years, rather than living in torment and maybe having to live in an institution rather than at home. But this would, it's flexible enough, that fishing pole flex technology, that it's not rock hard, but it will do a nice job of holding their head forward with their torso in that 90 degrees at the hip. And you should see your patients do very well, and they'll be relaxed. Again, this is the NeuroFlex Restorative Hyperextension Stop that goes with the Vertebrese TLSO.